Hello, everyone, and welcome to Mackenzie Health's Community Telephone Town Hall meeting. We are live tonight with Altaf Stationwala, President and CEO of Mackenzie Health, and members of Mackenzie Health's executive leadership team. In addition, we are joined by thousands of residents from across Vaughan, King, and Richmond Hill who are listening in this evening. To ask a question live tonight, simply press 3 on your phone's keypad. Once again, press 3 to ask a live question at any time during tonight's town hall. My name is Eric, and I'll be moderating the town hall this evening. During this live community telephone town hall, we encourage you to get involved and to ask questions and give your opinion by voting on a few questions we have for you. Mackenzie Health chose this format as this is an interactive town hall with you, which means we want to hear from you. Altaf and Mackenzie Health's executive leadership team want to hear your feedback and opinions and have an open dialogue and discussion with you and other residents. Tonight, we want to provide an update on how our hospitals are working together to provide critical services to our community while expanding and enhancing other services that residents rely on. Our intention is to get as many questions from you as possible. Once again, you can ask a live question at any time by pressing 3 on your phone's keypad. Someone will take your name and place you in the question queue. Now, we're still having new people join us. I want to welcome everyone this evening to Mackenzie Health Community Telephone Town Hall. We are live tonight with Altaf Stationwala, President and CEO of Mackenzie Health, and members of Mackenzie Health's executive leadership team. In addition, we are joined by thousands of residents from across Vaughan, King, and Richmond Hill who are listening in. We want to remind everyone joining us that if you have a live question you'd like to ask, you can press 3 on your phone's keypad at any time during the town hall. Someone will take your name and place you in the question queue. We also have a few survey questions that we're going to be asking the audience. You'll have a chance to vote live using your phone's keypad on those questions as they come up. So at this time, I'm now going to introduce Mackenzie Health's President and CEO, Altaf Stationwala, so he can open up the town hall. Altaf, welcome. Last year, Mackenzie Health became a 2-hospital organization when Cordalucci Vaughan Hospital opened to join Mackenzie Richmond Hill Hospital in supporting the community. Each is a full-service hospital offering core services such as emergency, critical care, medicine, and medical imaging, as well as specialized programs. I know there are a number of individuals joining you this evening, so Altaf, please go ahead.
Thank you very much, Eric. Welcome to our telephone town hall. We're looking forward to this opportunity to speak to residents across Western York region and hear directly from you this evening. Mackenzie Health is situated on treaty lands that have been lived on and cared for by generations of the Mississaugas of the Credit. It is the traditional territory of other First Nations, including the Haudenosaunee and the Wendat. This land is currently home to many First Nations, Métis, and Inuit people. Mackenzie Health is grateful for the opportunity to deliver essential care to patients in this territory. We have a telephone town hall at least once a year to have this important two-way conversation with you, our community, to complement the information we share with you throughout the year through our website, social media, and regular newsletters. Before we start providing with updates, we'd like to ask you our first question. Eric, can we start with the first polling question, please?
Understood. We have our first polling question ready to go. Just before we get to it, I want to remind everyone that if you have a live question you'd like to ask, you can press 3 on your phone's keypad. Someone will take your name and place you in the question queue. So while we're not doing the poll, during times we're not doing polls, you can press 3 to ask a live question. Right now we're going to do a polling question, and you can use your touch-tone phone to indicate your response on this question. We want to know, here's the question. I'm going to set it up. As you may know, Mackenzie Health is a regional healthcare provider serving more than 500,000 people across York Region and beyond. Mackenzie Health currently includes 2 hospitals, Mackenzie Richmond Hill Hospital and Cordalucci Vaughan Hospital, as well as a network of community-based locations in Richmond Hill, Vaughan, and the surrounding communities. Before this survey, how familiar would you say you were with Mackenzie Health? Press 1 if you're very familiar and could explain the organization to others in detail. Press 2 if you're somewhat familiar but don't know all the details about the organization. Press 3 if you've heard of Mackenzie Health but don't know any of the details. Press 4 if you have not heard of Mackenzie Health before this survey, and press 5 if you don't know. So again, as you may know, Mackenzie Health is a regional healthcare provider serving more than 500,000 people across York Region and beyond. Mackenzie Health currently includes 2 hospitals, Mackenzie Richmond Hill Hospital and Cordalucci Vaughan Hospital, as well as a network of community-based locations in Richmond Hill, Vaughan, and the surrounding communities. For this survey, how familiar would you say you were with Mackenzie Health? Press 1 if you're very familiar and could explain the organization to others in detail. Press 2 if you're somewhat familiar but don't know all the details about the organization. Press 3 if you've heard of Mackenzie Health but don't know any of the details. Press 4 if you have not heard of Mackenzie Health before the survey, and press 5 if you don't know. Altaf?
Thanks, Eric. We've been operating as a two-hospital organization for a year and a half now, since we opened Coeur d'Alene Hospital in 2021. Today, we'll give you an update on how we're supporting the community with programs and services distributed across our two hospitals and our community-based sites. We'll give you an update on how we're managing the capacity and staffing pressures that we're facing here at Mackenzie Health, which is also impacting hospitals across the province. We'll also provide an update on what's up next for Mackenzie Health and how we're planning ahead to ensure we grow with our community. We also want to give you the opportunity to ask us your questions. Joining me this evening are Dr. Stephen Jackson, our Vice President of Medical Planning and Chief of Staff, Mary Agnes Wilson, our Executive Vice President, Chief Operating Officer, and Chief Nursing Executive, and Stav DeAndrea, our Vice President of People Services and Chief Human Resource Officer. So let's get started. We've been on quite a journey here at Mackenzie Health, and in June, we celebrated the first anniversary of becoming two hospitals. Long before we opened our second hospital, Mackenzie Richmond Hill Hospital consistently had one of the busiest emergency departments in the province. When we opened Coeur d'Alene Hospital as a full-service hospital last June, we doubled access to care for residents across Western York Region. You may remember that when we initially opened Coeur d'Alene Hospital as a system solution to support the provincial pandemic response in February 2021, before it was fully opened in June of 2021 to support our entire community. In those first 5 months, we cared for more than 600 COVID-19 patients transferred from overwhelmed hospitals all across the GTA. Without the relief we provided during this time, the healthcare system in the GTA would have been at risk of collapse. We are very proud to play this important role in the fight against COVID-19. Today, we're so pleased that we have a second full-service hospital to support our community, and it's so desperately needed. I'd now like to ask Mary Agnes to talk a little bit more about our programs and services here at Mackenzie Health.
Thank you, Altaf. Mackenzie Health's two-hospital system was uniquely designed in a way that our hospitals work together to provide core and specialized services to Vaughan, Richmond Hill, King, and surrounding areas. Both our hospitals have core services. These are high-volume services that meet the needs of our communities, such as our emergency department, critical care, surgery, medicine, medical imaging, including CT scans, MRIs, ultrasounds, and X-rays. Each hospital offers different specialized services that meet the needs of our community. At Coeur d'Alene Hospital, specialized services include our inpatient integrated stroke unit, inpatient mental health program, our women and child program, including obstetrics and pediatrics. At our Mackenzie Richmond Hill Hospital, specialized services include chronic kidney disease program, complex continuing care, rehabilitation, and our ambulatory program that includes our fracture clinic, medical urgent care clinic, and the SHAW clinic that offers child and family mental health supports. We know that change takes some getting used to, and that there may still be some confusion in the community around which hospital to go to for care. We want you to know that no matter which hospital you go to, you'll receive quality care from a team of healthcare experts that work across both our hospital sites. If you're coming to the hospital for an appointment, remember to check your appointment information before you arrive to the hospital to ensure that you go to the right location. You'll typically receive either a phone call or a text reminder in the days before your appointment with this information. For example, MRIs and surgical appointments can occur at either site, depending on the availability and your condition. Mackenzie Health also provides a variety of community-based services that span the geography from North Toronto to up to Barrie and from Highway 50 over to the 404. These include the Centre for Behavioral Health Sciences, including autism supports in Richmond Hill and Barrie, Diabetes Education Centre, and our Rapid Access Cardiology Clinic at 955 Major Mackenzie Drive, and our Urgent Care Centre at 9401 Jane Street. At Mackenzie Health, we offer breadth of programs and services to support our community. These programs all work together and complement each other to give you the care that you need, where and when you need it. Now I'll pass it back to Altaf to talk about how our two hospitals work together.
Thank you, Mary Agnes. So I'll just take a moment to share an example of how our programs work together across our multiple sites. We have 2 full-service emergency departments with specialists and subspecialists at both. No matter where you go, you'll receive the care you need. As an example, if you live in Vaughan and come to your closest emergency department at Cordalucci Vaughan Hospital with a broken foot, you'll be checked out and receive your initial tests and scans. Any follow-up appointments will be at the fracture clinic at Mackenzie Richmond Hill Hospital. You'll have access to the same team of expert physicians at both sites and receive the care you need where and when you need it. This is the experience that all patients who come to us for care should expect to have. No matter which of our hospitals or community-based locations you come to, you receive seamless care by an expert team of nurses and physicians. Eric, let's go to our next polling question now.
Understood. We have another polling question we're going to do now. Just before we get to that, I want to remind everyone that if you'd like to ask a live question on the town hall, you can press 3 on your phone's keypad while we're not doing survey questions, and you'll have a chance to ask a live question. Someone will take your name and place you in the question queue. So again, press 3 on your phone's keypad, and you'll have a chance to ask a live question. But right now, we're going to do a survey question. So everyone joining us, you can indicate using your touchtone phone your response to the following question. We want to know, have you or a member of your family ever been a patient at Mackenzie Health? Press 1 if you have been a patient at Mackenzie Health. Press 2 if a member of your immediate family has been a patient at Mackenzie Health. Press 3 if you or your family member have not been a patient at Mackenzie Health. And press 4 if you don't know. So again, have you or a member of your family ever been a patient at Mackenzie Health? Press 1 if you have been a patient at Mackenzie Health. Press 2 if a member of your immediate family has been a patient at Mackenzie Health. Press 3 if you or your family have not been a patient at Mackenzie Health. And press 4 if you don't know. Altaf?
Eric, why don't we go to the next polling question, please?
So we do have another polling question that we're going to do in a few moments. I think right now we're going to take our first live question. So joining us up first, we have a question from the community, and I believe it's going to be Alberta who's joining us live now. Alberta, welcome. Please go ahead. Hi, Alberta, you're joining us live on the line. Please go ahead with your question. Hi, are you there, Alberta?
Yes, I was thinking of how Emerge is together with the 2 hospitals, but it was answered briefly about the Emerge.
So Eric, why don't I take a sort of a shot at answering that question? Thank you so much, Alberta. And I think the question is how our 2 emergency departments work. So both hospitals, Mackenzie Richmond Hill Hospital and Cordalucci Vaughan Hospital, have full-service emergency departments. So we have emergency physicians, we have emergency nurses, and we have all the subspecialists, the consultants that support both emergency departments. So they are both full-service emergency departments. They work in tandem. And then depending on the follow-up care you need, you may get additional services at either of the 2 hospitals or our community-based locations. So Eric, maybe we'll go to the next question.
Understood. We have another question ready to go. Again, a reminder, press 3 on your phone's keypad if you'd like to ask a live question on the town hall this evening. Elish is joining us live now. Elish, welcome. Please go ahead.
Yes, hi, this is Elish. Thank you for giving this opportunity. Very briefly, I must say that before COVID, we had extended hours service from the outpatient for the blood work at the lab. Now we have reduced the hours to 2 o'clock only, and we are getting back to normal situations now. So are we planning to do going on extra hours so that way some patients cannot come until the afternoon so they can be accommodated?
So are you referring to outpatient lab services, blood work services, just to clarify?
Yeah, like example, I come for my follow-up appointments every quarterly, and I have to get my blood work done. before my appointment, and I try to come a couple days before so that way the blood work is ready for the doctor to rather than waiting or anything. So that's where I come for my blood work that has to be done at the hospital. And that's what I'm referring to going in the appointment.
So in terms of additional hours, so absolutely. So as you can imagine, we did adjust many of our services during the COVID pandemic, but as things are opening up and as we're returning to a more normalized model of care delivery, those hours are also being extended. So hopefully that responds to your question. Eric, maybe we'll take another question from our audience.
Understood. We have another live question coming up. Again, reminder to everyone joining us to press 3 on your phone's keypad if you'd like to ask a live question. So now we have Tatlin joining us now. Tatlin, welcome. Please go ahead.
Yes. I would like to know if Luci that's the big hospital, to know if the hospital is a teaching hospital. That's my question. Thank you.
Sure. So I think the question that's being asked is whether we are a teaching hospital and whether we have learners in our environment. So I'm going to get Mary Agnes and Stephen to provide additional commentary. But we have learners and students in our environment all the time. We actually have a number of residents and fellows and nursing students in our environment, both to enable us to train the future generation, but also to ensure that we have an exceptional talent pool coming into the hospital. But maybe I'll get Mary Agnes to speak about some of the nursing training programs and then Stephen to speak to some of the medical training programs. So go ahead, Mary Agnes.
So thank you, Altaf. I think typically when people talk about hospitals being teaching hospitals, they're usually talking about some of the hospitals that have formal affiliations with our universities and our schools of medicine. So Mackenzie Health, or in Coeur d'Alene and Richmond Hill Hospitals, we don't have a formal affiliation with the School of Medicine. But as Altaf stated, we do have learners in our environment. So we have worked very hard to provide access to a variety of healthcare providers, nurses, respiratory therapists, OTs, occupational therapists, physiotherapists, social workers who are learning to come to our hospital to work with us and to learn how to be healthcare providers. I'm happy to say that we have increased the number of student placements that we're able to offer over the last many years. We've in fact doubled those student placements, so we get many requests from a variety of different universities and colleges for their students to come here and learn, and we do our best to accommodate them. In terms of our medical staff, I'll let Dr. Stephen Jackson answer that question.
Thanks, Mary Agnes. We have medical students from different medical schools, including University of Toronto, McMaster, and elsewhere, as well as residents and even fellows, which are fully licensed physicians that are actually getting subspecialty training in further areas of expertise. And we have them coming to the hospital to do electives in surgery, medicine, emergency medicine, obstetrics, pediatrics, multiple different people coming and getting training at any particular time. So while we're not as big a teaching hospital as University Health Network, we are still considered a teaching hospital for elective students and residents to get a different type of community experience.
Okay, thank you, Dr. Jackson. So Eric, I'm going to turn it back to you at this point.
We have another question ready to go. Press 3 on your phone's keypad if you'd like to ask a live question on the town hall this evening. Up next, we have Wayne joining us. Wayne, welcome. Please go ahead.
Yes, I was wondering if Mackenzie Health has given any thought to implementing telehealth services so people could access them over the internet or phone without having to go to your bricks and mortar facilities.
Well, thank you for that question, Wayne. So the question is, have we considered offering telehealth and telemedicine services? So we do provide a number of programs virtually and through telehealth. I'm going to actually get Mary Agnes to speak to some of those programs, and then Steve and Dr. Jackson as well, if you can supplement. Thank you. Mary Agnes?
Thank you, Altaf. So yes, we do have a variety of services that are being provided virtually, and that ranges from everything from some counseling services through follow-up services that are provided in some of our specialty clinics. We also provide telehealth access for some of our stroke patients and many services. We're actually in the process of rolling out a virtual rehabilitation program and a virtual speech-language pathology program for some of our stroke patients in the community. So we do have telehealth services available, but clearly most of the patients who come here need to be physically present because we need to actually see them and provide care and treatment for them. So not all services can convert to telehealth, but those that can, we are making headway into converting those services and making it more convenient and accessible for our communities.
We've been able to learn a lot from the pandemic in terms of how to provide services in a different way, and we were in a way forced to provide services in a more remote virtual way, and we have gotten better at it, and we're still expanding the capability to provide video conferencing as well as telephone consultations. We're doing a lot of it already, but the future is going to be something we're looking forward to in terms of expansion of these services to more and more clinics and outpatient facilities.
Thank you, Dr. Jackson. Eric, we'll turn back to you.
Up next, we have our next live question. Again, a quick reminder, press 3 on your phone's keypad if you'd like to ask a live question. We have Irene, who's joining us now. Irene, welcome. Please go ahead.
Thank you. My question is about the impact of the staffing shortages that we all hear about on the news, particularly the nursing staffing shortage as well as the pediatric difficulties that we're experiencing across the province. I would like to know what the two hospital sites are doing to ensure there's a greater service and what we can do in the community to help make sure that our nurses and our other important staff in those hospitals are supported.
So thank you for that question, and I must say that the staffing shortages are real. We face it every single day, as do the majority of the hospitals across this province. So we continue to recruit new staff every single day. In fact, in the last 11 months, we've added a net 500 new staff to Mackenzie Health. As you can appreciate, we are not only trying to sustain our current services, but continue to grow into our two hospitals. So for us, obviously, it's sustaining services, but also growing into both sites so that we can meet the needs of a growing community. We have a number of programs. Many of them are sponsored by the province to ensure that we can bring in a greater number of new trainees. One very unique program that actually got launched at Mackenzie Health many, many years ago first is an extern program where we actually bring in nursing students in their third and fourth year, enable them to work in tandem with our nursing staff so that they can get the skills and the training, but also actually add some additional sort of hands in the care environment. So we've continued to grow in that way. In terms of the pediatric challenges, they are real. They are real very much by the fact that we've seen an incredible increase in the volume of pediatric cases, both in our emergency department and in our inpatient pediatric unit. On many days, we are running well over 250% above our bedded pediatric inpatient capacity. So we've actually increased the number of beds. We've grown from 6 beds to 11 beds in the last few weeks just to sustain the volumes. And when we can't care for patients on the inpatient unit, unfortunately, at times we are also having to provide care in the emergency department on an inpatient basis. But maybe Mary Agnes and Stav, I'll get both of you to comment on some of our efforts around recruitment and retention of staff. Stav, would you like to start?
Sure, thank you, and good evening, everyone. And an important question. At Mackenzie Health, we have leveraged a number of the ministry-sponsored initiatives. So one of the ones that Altaf mentioned was the clinical externs. We also are leveraging the Nurse Graduate Guarantee Program, which enables graduates to have a very robust orientation program. There's also a program for supervised practice and experience partnership, and this once again enables us to build capacity within our organization with new nurses coming in through our doors. We also have a community commitment program for nurses and continue to press upon multiple strategies because there isn't a singular solution. And as what you read in the newspaper is real, and we live and experience it on a daily basis, which continues to put ongoing pressure on our staff, our physicians, and our volunteers who also support our services here at Mackenzie Health.
Mary Agnes, would you like to supplement?
Thank you. Yes, the pressures in the healthcare system are very real, both from nursing staff as well as our medical staff, all of our providers. One of the unique challenges that we have at Mackenzie Health is that we planned on opening our second hospital with a certain number of beds because that is what we anticipated that we would need. We did open those beds and we recruited the staff to provide that care. What we have found since COVID-19 and in the past a couple of year and a half since we've been opened is that the demand for our services is greater than we had anticipated. And with that demand has put pressure on us to continue to open more beds and to build more capacity. And as you've heard Altaf mention, we have continued to recruit and we're very happy with that outcome, but we still have a ways to go. So this is an effort that we work at every single day. The efforts that we have put in place that Stav spoke about in terms of the taking advantage of a lot of the ministry initiatives that have been put forward are very real. But to the caller's question before around being a teaching hospital, we see this as a commitment to bringing in our students, to helping them transition into being healthcare professionals, and to having a career with us and to stay in the community to continue to support the needs of the community. So those are the efforts that we're putting in place, but it is a long road and will take some months and years to sort out.
Thank you, Mary Agnes. And it's important to recognize that we recruited well over 2,000 new staff in the opening of Coeur d'Alene Vaughan Hospital in the last 24 months. So we've done very well on that recruitment front, but as has been stated by all of our speakers, we're always sort of playing from behind in terms of catching up with the demands of the community. Eric, why don't we take one more question from the audience?
Of course, we have another live question ready to go. Again, a quick reminder to everyone joining us, press 3 on your phone's keypad if you'd like to ask a live question. We have Marcia joining us now. Marcia, welcome. Please go ahead.
Marcia is a diabetic patient. From 2013, and I had a diabetic advisor the first month, but I have nobody to help me now. I do not have a family doctor. Do you have anything for helping diabetic people?
So, Marcia, thank you for your question, and the question is around diabetic care at Mackenzie Health. So we do have a number of diabetic programs, and first, Marcia, what I would say is if you go on our website, you'll see some of the availability of family physicians that are still taking patients, and there are other ministry websites that can enable you to get connected to a family physician in your community if you do not have one. So I encourage you to do that first, and then obviously you can get support with a number of the specialists, especially endocrinologists that may be able to help you with your diabetic condition. We at Mackenzie Health actually have a diabetes education program. We run a number of clinics that a family physician can then refer you to. So those programs are available, and again, would encourage you to go on a number of websites to get connected to a family physician so you can get the care and the treatment that you need. And again, some of the programs that are offered here at Mackenzie Health. Eric, I'll turn it over back to you now, and maybe we'll go into the next section of our program.
Understood. Now, I just want to take a quick moment to just remind everybody how they can ask a live question. And, of course, I want to welcome, we still have some new people joining us to Mackenzie Health Community Telephone Town Hall, We're live tonight with Altaf Stationwala, President and CEO of Mackenzie Health, and members of Mackenzie Health's executive leadership team. We're taking your questions. We're joined by thousands of residents from across Vaughan, King, and Richmond Hill who are listening in. We are doing a few survey questions, but I want to let everyone know if you have a live question you'd like to ask, you can press 3 on your phone's keypad. At any time during the town hall, someone will take your name and place you in the question queue. We've already had some Q&A questions already. We've done a few survey questions, and we have some more Q&A coming up a little bit later. But right now, I know Mary Agnes is joining us and would like to give some information out to everyone listening.
Thank you, Eric. I'd like to share with you what we're seeing every day at our 2 hospitals and talk about how we're managing the challenges that we face. Through it all, we continue to ensure we're providing you with the best care possible. As you've heard in the media and elsewhere, hospitals across Ontario are experiencing significant pressures due to high volumes and staffing shortages. We're facing the triple threat of COVID-19, respiratory illnesses, and influenza. At Mackenzie Health, both of our hospitals are operating over capacity, and many of the people that are coming to our emergency departments are very sick and need to be admitted, including an increasing number of children. Before we opened our second emergency department, it was estimated that we would see about 375 patients per day across both of our hospitals. Today, we're seeing more than 600 patients per day, nearing double what was projected. We're also seeing close to an 80% increase in the number of children coming to our emergency departments. Most of these children have respiratory or flu-like illnesses, including RSV. This means that we have children needing to be admitted to a hospital bed. We have increased the number of beds that we have available for children to meet those needs, but on many days, that is still not enough. We have more children needing hospital beds than we have beds available, and we want our community to know that we work with our partner hospitals to ensure that we can provide an appropriate inpatient bed for our patients that need a bed. This means that we will transfer children to another hospital to ensure access to care for all our patients if we need to. Our urgent care center is experiencing a higher number of patients coming for care than ever before. Our urgent care center is seeing double the number of people daily. We went from 40 visits a day to over 80 visits on a regular basis. With the masking and physical distancing restrictions that have been in place for the past few flu seasons, the traditional impact of influenza was not as acute. People weren't experiencing colds, the flu, or other respiratory illnesses in the same numbers that they are today. This is resulting in more people coming to our hospitals for care. We are operating at or over capacity most days in our inpatient units. So when a person who is very ill comes into our emergency department and needs to be admitted, they often need to wait in the emergency department until a bed becomes available on one of our inpatient units. This is not the experience we want for anyone. Some days there are more than 60 patients in our emergency departments waiting for a bed, and we know that this is not ideal. We continue to work hard to assess patients who come to our hospital's emergency department as quickly as possible to determine that the sickest patients get care first. We aim for less than 2 hours to see a doctor in our emergency department, and we've been able to maintain that on average. But there are days recently where that's been unfortunately longer. Waiting in an emergency department for an inpatient bed is not the experience we want for our patients. We appreciate your patience and understanding as we do all we can to provide the best care possible during this very challenging time. As we see more and sicker patients in our emergency departments, we have needed to open more beds. We operate on most days at over 110% occupancy of our inpatient medicine beds. This means that we've had to continue to hire staff to meet the unexpected growth in demand for hospital services in our communities. As you've heard, we're currently experiencing a healthcare staffing crisis. This means that having extra nurses available to care for sudden increases in patient admissions is very difficult. All of this adds to our wait times and our ability to meet your needs. There are a few things that you can do to help. We encourage everyone to get the flu shot and keep up to date with their COVID-19 booster shot. If you're sick, please stay home and get better. Going to work or going out and increasing the spread of respiratory illnesses in our community is not a good thing to do. Ontario's Chief Medical Officer of Health also recommends wearing a mask in indoor settings, especially if you're interacting with high-risk people like children and older people. If you have a family physician, they can provide you with options for non-emergency care. Walk-in clinics and urgent care centers are also available. But if you need emergency care, do not hesitate to come to the emergency department. Our team is here to help you. One thing that we do ask of you is to be kind and respectful to those providing care. Being in hospital is already a stressful time, and we know that no one wants to wait. But unfortunately, we're seeing an increase in aggressive and abusive behavior towards our healthcare workers, and that is not acceptable. We are committed to providing a safe, healthy, and respectful environment to everyone who walks through our doors. We commit to treating you with professionalism, respect, compassion, and we expect the same from you. I can assure you our staff, physicians, and volunteers are giving their all during this incredibly difficult time. Now I'd like to pass it over to Stav D'Andrea, our Vice President of People Services and our Chief Human Resource Officer, to speak about the work we're doing to recruit more staff.
Thank you, Mary Agnes. The past few years have been a very challenging time for healthcare and healthcare professionals. You will have heard earlier the tremendous increase in patient volumes, and that translates into increased staffing needs. Our staff and physicians continue to work under tremendous pressures. Like all hospitals, Mackenzie Health is challenged with staffing shortages given our current health human resources crisis. Our staff are feeling these pressures every day, and they continue to work hard and step up to fill additional shifts. They work extra long hours to fill the gaps and are doing all that they can to support the patients and their colleagues. That is why recruitment, and importantly, retention, continues to be a priority for us. While staffing challenges are being felt across the healthcare system, Mackenzie Health is in a unique position. We have been in a period of constant recruitment before and after opening our second hospital and doubling access to care for our community. The more we grow and expand our programs and services to support our growing community, the more staff we will continue to need to hire. Currently, the greatest number of vacancies for clinical positions are in critical care, medicine, and our two emergency departments. We are doing all we can to address this. In the past year, we have increased our total headcount by more than 500 staff, representing a 12% increase from about 4,500 to more than 5,000. This is over and above the approximately 2,000 employees hired to support the opening of Cortellucci Vaughan Hospital. We are employing numerous recruitment strategies, including some innovative models to ease staffing challenges where we can. As an example, we have adjusted our staffing models in a number of units, including critical care, to a team model where clinical externs support our registered nurses as they deliver care. We have also provided additional incentives for our nursing staff to support weekend and evening shifts to ensure we have the necessary staff available for these shifts. We continue to ramp up our recruitment marketing efforts and participate in virtual and on-site career fairs across the city and beyond. We are participating in programs offered through the Ministry of Health to recruit and create positions for recent graduates and clinical externs. We have increased our outreach to students, and we are creating multiple opportunities for professional and personal growth and development. We continue to explore all avenues to recruit and retain staff we need to care for the patients we serve in our communities. When we review the community growth patterns, it is predicted that by 2030, the population of York Region is expected to grow by 750,000 people. Those are the people who at one point in their lives might require care at one of our hospitals. That is why it is so important that we continue to grow along with our communities so that we are always able to deliver the necessary care when and where our community needs it. Eric, let's go to some questions from our community.
Well, we have our first, or rather our next Q&A question coming in for this segment, and it's going to be Daniel who's joining us now. Daniel, welcome. Please go ahead with your question.
Good evening, everyone. My question is pertaining to the mental health. Are there plans to expand and or update the mental health care departments or facilities?
So thank you for that question, and the question is related to expanding mental health services. So we do provide mental health emergent services in both our emergency departments, so that is for individuals that may be going through crisis or other issues. We have an inpatient mental health program located at the Cortellucci Vaughan Hospital. We also have a number of clinics at the Mackenzie Richmond Hospital for mental health patients. And we actually have an active proposal in front of the Minister of Health as we speak to grow additional inpatient programming at the Mackenzie Richmond Hospital for geriatric mental health, which is a real challenge in terms of the care that's provided today in the community, a service that's really lacking. So that's a proposal that we've actually done with an academic hospital, Ontario Shores, that's located in Whitby. So as we see in the community and as the pandemic has clearly demonstrated, there's a great gap in the available care for the community when it comes to mental health. And obviously we're aware of that, and we continue to grow services and advocate to our funders to expand the services that this community needs. Eric, we'll go to the next question.
Understood. We have our next live question coming up. Again, a reminder to everyone joining us, if you have a live question that you'd like to ask on the town hall, you can press 3 on your phone's keypad at any time, and we'll take your name and place you in the question queue. We have Vishwash, who's joining us now. Vishwash, welcome. You're joining us live. Please go ahead.
Good evening, everybody. I just want to share my experience that I was at Cortellucci Vaughan Hospital I had to go to the emerge department, and I was there at 8:45 in the morning. And to my surprise, the staff, doctors, the nurses, the support which was provided to me was excellent. When I completed all my tests, I was out before 12 o'clock. And when I checked again in the waiting area, there was none. My number was 38. And when I left about 11:45, it was 98. But that means almost like 65 patients have been taken care of within that 3.5 hours. Next time when I went, my appointment was at 1:50 p.m. in the morning. And to my surprise, they called me at 1:52. I just want to thank you, the staff, nurses, and doctors, for the support which you provide to the community.
Well, thank you so much for your feedback, and I know that many of our staff are actually listening in on this teletown hall, and they will be incredibly pleased by your feedback and the generosity of your comments. I know that they work incredibly hard, as Mary Agnes and others have shared. It is a very, very challenging environment. Our staff have been battling COVID and additional waves of influenza and now RSV, and continue to come to work every single day, despite the challenges that they face in terms of workload and some of the staffing gaps. So again, thank you for that amazing feedback, and thank you for sharing a very positive experience at Mackenzie Health. And as was described earlier, our emergency departments are incredibly busy. Well over 600 patients a day treated between both emergency departments, and then another 100 treated at our urgent care center. So we will do well over 250,000 emergency visits in this calendar year. So again, a very, very busy place at Mackenzie Health, and thank you for your feedback. Eric, we'll go to the next question.
Up next, we have Tanya, who's joining us live now. Tanya, welcome. Please go ahead with your question.
Yes, hi. My question is that my son is a high school student, and he needs to do his hours. He was wondering if the hospital is accepting students to do their volunteer hours because he wants to become like a doctor, an orthopedic surgeon, so he wants to apply to university. So he thought that maybe that would be good on his resume or his application. I don't know if that's one of the options that he can do at your location, or and how he can go about, if that is, how he can go about doing that.
So I'm going to pass this over to Stav DeAndrea to talk about our incredible volunteer program. It is, I think, one of the more exceptional things that we do here at Mackenzie Health. Our volunteers are really the heart of the hospital. So, Stav, maybe you could talk a little bit about the whole program as well.
Yes, thank you so much, Altaf, and couldn't agree more. We have a robust volunteer placement program that offers services to not only the two hospitals, but also our ancillary sites within our community. And we do have, to your point, regarding student placements, we have placements throughout the year that we have an opportunity to recruit and assign to various areas throughout the organization. And so our website has all of the details to support application, and there are other areas as well, not only for students, but also for individuals that are interested in giving back to their community hospital and providing services in a variety of different programs throughout, whether it is at the entranceway, through our wayfinding experience, through our Women and Child program, providing directional support, or a gift shop at the Richmond Hill location. So there are a number of opportunities, and welcome the community to look at our website and express interest and provide support to our organization. So thank you for your question.
Thank you, Stav. And I think we have well over 1,200 volunteers that support Mackenzie Health every single day. So it's a very vital program and a great way to give back to your community. And again, for young emerging clinicians, a great way to learn what goes on in the hospital. So we're absolutely happy to have your son apply as long as he promises to work here at Mackenzie Health once he graduates. Eric, we'll go to the next question.
Up next, we have another live question. A reminder, press 3 on your phone's keypad if you'd like to ask a live question on the town hall this evening. We have Barbara, who's joining us now. Barbara, welcome. Please go ahead.
Thank you for taking my question. If chemotherapy is ordered from downtown Princess Margaret Hospital, can one have this treatment in a coordinated fashion at Richmond Hill Mackenzie Health instead?
I'm going to get Mary Agnes to answer that question.
Thank you. That's a great question, and the question was about if your treatment is prescribed at one hospital, can Mackenzie Health meet those needs? So I'm going to give you two answers. One is yes, and one is maybe. Cancer treatments are generally provided according to a protocol that any hospital in Ontario should be able to provide. So the standardized treatment protocols, or the treatment protocols are standardized across the province. And so for most typical cancers, now say most, those treatments can be provided at your hospital close to home. The maybe part of it is that not all types of cancer are treated across the system, and if you have a very specialized cancer or you have a very specialized treatment protocol, we may or may not be able to assist you with. If you are currently receiving treatment at Princess Margaret Hospital and want to receive treatment closer to home, I would suggest that you speak to your provider at Princess Margaret and speak with them to see if your care can be transferred. That would be the best place to start. But yes, we do provide chemotherapy services here for a variety of different cancer treatment protocols. But again, it would be depending on your very specific treatment if we would be able to accommodate that here.
Thank you, Mary Agnes. Eric, we'll go to some more polling questions, please. Actually, why don't we take a few more questions from our audience first?
Understood. We have more live questions that we can take. So a reminder to everyone joining us that if you have a live question, we do want to hear from you this evening. You can press 3 on your phone's keypad at any time. Someone will take your name and place you in the question queue, and you'll have a chance to ask that live on the town hall. We're going to go to Dennis now, who has a live question. Dennis, welcome. Please go ahead.
Hi, I'm Dennis. I live in Richmond Hill. Am I restricted to only using the Mackenzie Health Emergency Department, or can I also use the services of Carter-Colucci Hospital in case of any future eventuality?
No. So the question is, am I restricted to use one emergency department if I live in that community, in this case, Richmond Hill? So no, you can use any of the hospitals, depending on your preference or depending on where you are. So again, both emergency departments are full service emergency departments. They both have the same group of physicians that actually practice between both hospitals. So that's the one amazing and unique thing about Mackenzie Health. Our medical staff actually practice at both hospitals. So our emergency physicians will actually rotate through all of our sites. But again, you can go to either of the emergency departments depending on your preference and where you happen to be in the community. Eric, we'll take another question from our audience.
We have another question coming up now from Aria, who's joining us live. Aria, welcome. Please go ahead.
Thank you very much. Good evening, everyone. My question is, how would a patient who has been treated at emergency for heart problems access a support group for information, education, and support?
So there are many resources available in the community and many other resources online. Heart and Stroke is a great website to get additional information if you're looking for follow-up care. We do have a number of cardiac clinics at Mackenzie Health, and we actually have a cardiac rehab program as well. The normal course of being referred to any of these programs will be through your family physician or your cardiologist. And again, I think your family physician would probably be the best resource to connect you to the services that are available in your community. But again, at Mackenzie Health, we do have a number of services that are available. You would need to be referred into those programs by your family physician or your specialist. Eric, we'll take another question from our audience.
Understood. Up next, we have Daniel, who's joining us live now with a question. Daniel, welcome. Please go ahead.
Thank you for taking my question. My question is the area of communication, accessibility. It's often assumed that people just read and write, and I have middle ear deafness, and I don't read and write, and it's embarrassing when you have to find somebody when you're trying to admit for a procedure at the hospital. What can be done to improve it so that you're not struggling to try and find somebody that just automatically assumes that you can go on a computer to register? Thank you.
No, thank you for that question. And we always try to ensure that we provide our services that are accessible to all of our community members. And obviously, in your case, we do have staff and volunteers available to assist you in the registration process or any other service that you may need. But I'm going to get Staff Andrea to talk a little bit more about how we approach accessibility at the hospital and, again, how we can improve. And, again, if there's specific feedback, please do go on to our public affairs website and our email and provide a specificity there. But I'm going to get staff to talk a little bit about some of the programming that we do offer.
Yes, thank you for your question, and once again, an important one. When you enter the doors of our hospital, whether it's Richmond Hill or Carter-Colucci Vaughan Hospital, we do have our volunteers placed there to be able to support some of the needs. And as it relates to computer literacy or support in translation or anything of that nature, our volunteers will support, as will staff, so the questions can be brought forward at that time. We also have a robust programming as it relates to the not only legislative requirements for accessibility, but we also have a committee that looks after what are the needs that we can continue to build upon and provide services for our patients and the community that enters through our doors. That is also available on our website, and there are also services within the programs so that if information or any service that's required to support the specific needs of a patient, those can also be brought forward, and our nursing support will be able to assist you.
Thank you, Stav. Eric, I think we'll go to our next polling question. This is polling question number 3.
Correct. We have our next polling question ready to go, and for everyone joining us, you can indicate your response using your touch-tone phone. We want to hear from you. In the past few months, have you read, seen, or heard anything about Mackenzie Health? Press 1 if yes, you have read, seen, or heard anything about Mackenzie Health in the past few months. Press 2 if no, you have not read, seen, or heard anything about Mackenzie Health in the past few months. And press 3 if you don't know. So again, we just want to know, in the past few months, have you read, seen, or heard anything about Mackenzie Health? Press 1 if yes, you have read, seen, or heard anything about Mackenzie Health in the past few months. Press 2 if no, you have not read, seen, or heard anything about Mackenzie Health in the past few months. And press 3 if you don't know or are unsure. Up next, I'm going to pass it over to Dr. Jackson, who I know has some remarks to share with the audience. Dr. Jackson, please go ahead.
Thank you. Good evening, everyone. Over the past few years, we've been focused on our work to become 2 hospitals, and we've achieved some incredible feats on this journey. We're ensuring that both of our hospitals continue to be welcoming and in good condition for all staff, physicians, volunteers, patients, and their families. We have a unique opportunity at Mackenzie Richmond Hill Hospital right now. Since some programs, such as Women and Child, Inpatient Mental Health, and Integrated Stroke, moved to Cordalucci Vaughan Hospital, there are vacant spaces for a very limited time at Richmond Hill site. We're taking this opportunity to refresh the walls, flooring, ceilings, millwork, plumbing, and mechanical fixtures before we welcome new programs and services and patients into the new environment. If you visited Mackenzie Richmond Hill Hospital in the recent months, you may have noticed that much of this work has begun. The former home of our Women and Child program in our C Wing is now a refreshed space for the Orlando Corporation Ambulatory Surgical and Procedure Center. Moving this program into this new space increased our surgical capacity for endoscopy, urology, and minor procedures, so we can get these procedures done faster in a renewed space. Work is also underway in the A Wing, which houses our palliative care and complex continuing care programs. The first phase of this work to make aesthetic improvements to the space is expected to wrap up in the new year. Long-term planning continues on work to potentially expand our organization's footprint in Richmond Hill to respond to the needs of the growing and aging population in this part of York Region. We continue to explore possibilities to grow in the future. We continue to work with our government partners to expand and grow the programs and services we provide. We have a few proposals in with the provincial government, as you've heard, to address some of the gaps that we can bridge to improve healthcare in our region, including a proposal to expand the mental health supports available to seniors. Earlier this year, the provincial government announced an allocation of 256 beds for a Mackenzie Health long-term care home as part of the Vaughan Healthcare Centre precinct on the lands adjacent to Cordalucci Vaughan Hospital. Mackenzie Health already has the experience needed to support a long-term care home in our community. For more than 20 years, we've had oversight of the long-term care home at Mackenzie Richmond Hill Hospital, where we've cared for residents with complex care needs. The seniors population in Western York Region is growing, and we're proud to be able to support our community in this way. Finally, we wanted to touch on our strategy for the future. At our telephone town hall 1 year ago, we asked you for your input as we were beginning to develop our next 3-year strategic plan for the organization. We took all of the feedback we heard, and in June, we launched Mackenzie Health's new strategic plan, Trusted Team, Compassionate Care. This is our first plan outlining our objectives as a 2-hospital organization. The plan sets out Mackenzie Health's focus, efforts, and resources reflecting the needs of our patients and the communities we serve. We identified 4 key priorities that will guide our work for the next 3 years. Patient care excellence, people are our strength, growing with our communities, and integrated care. We commit to deliver reliable, safe care and excellent patient experiences. We will create a healthy workplace, supporting our people to deliver the best possible care and service. We will grow efficiently to meet our community's health needs close to home. And we will collaborate with community partners, including our Western York Region Ontario Health Team, to improve transitions and enhance patient care outcomes. Much of what we've spoken about here tonight shows this plan in action as we work on delivering on these priorities for our community. You can take a look through the plan on our website. These 4 priorities will guide everything we do as we continue to support our communities and deliver the best possible care. Now let's go to our final polling question. Eric?
As you mentioned, we have our next polling question, our last of the evening. We want to hear from you. You can use your touchtone phone to indicate your response on this question. We want to know what's on your mind when it comes to healthcare. Press 1 if it's wait times for services. Press 2 if it's the burnout of healthcare workers. Press 3 if it's integrated and seamless care. And press 4 if it's a positive patient experience. So again, what's on your mind when it comes to healthcare? Press 1 if it's wait times for services. Press 2 if it's the burnout of healthcare workers. Press 3 if it's integrated and seamless care. And press 4 if it is a positive patient experience. Now we have some more live questions that we're going to get to. Up next, we have Robert joining us. Robert, welcome. Please go ahead.
Hello, everyone. Hi. Am I on? Anyways, I was admitted into at the end of June regarding a healthcare episode. So I was someone had called my office wanting to schedule a consult visit, seeing if I would like to go and have a consult visit. They left a phone number. When I called that phone number, it's constantly a message service there. And I was wondering, I left the messages. It's probably the 3rd time now, last time being December 1st, and I'm not getting at least the minimal amount. Like the least thing someone could do is to call me back. I left the proper numbers. I was called at work instead of being called privately. I don't see how these things can happen. And so really seamless care is not really there. I understand you're taxed. So anyways, how can we keep the lines of communication open? Because the least I could have done is been given a call back. Must I go, my question to you is, must I go to emergency again and start this process all over again from June 30th?
So, Robert, let me apologize for that experience. That is in no way the intended service that we want to deliver. I'm not sure where the communication breakdown did occur here in terms of not having that follow-up visit. But I do encourage you to reach out to patient relations. They are available on our website, and they will immediately try to resolve your issue to ensure that you can get access to the care and the treatment that you absolutely require. And more importantly, we'll understand where the breakdown in communication occurs so that it doesn't happen to the next patient or resident of our community. So I do apologize. I'm not sure, again, the specific gap or issue that occurred. But again, if you've been given a number and been asked to call that number for follow-up care, you should be able to connect with someone. So I do apologize for that. Again, encourage you to reach out to patient relations. They are available on our website, and they will respond in the same day to try to address your concerns so that you can get the care that you need. Eric, why don't we take some more questions from the audience, please?
We have another live question ready to go. Helena, you're joining us live now. Helena, welcome. Please go ahead.
You mean Halida? It's me?
Yes, please. Yep, you're on live. Please go ahead with your question.
Oh, okay. I would like to request that the mask will be mandatory in the medical establishments, like attending chiropractor or physiotherapy. Nobody wearing masks. And to my understanding, the 2022, we have more COVID patients in the hospital than 2020 or 2021. So please do something to, to encourage or do as mandatory for medical establishment to keep us safe, please.
So, Haliva, thank you for the question. The question is, can we ensure that masks are mandatory in healthcare settings? So, Haliva, what I can assure you is that at Mackenzie Health, all of our clinical settings, a mask is absolutely mandatory. So our staff have to wear a mask, and anybody entering the facility has to wear a mask. So it is something that we enforce and that we absolutely believe is required considering the nature of the viruses and the safety of our patients, our staff, and our visitors. As it relates to other settings, I actually do not have authority over that, so I can't really provide a specific answer of what you may be seeing in other settings like chiropractic offices. But rest assured that at Mackenzie Health, masking is a mandatory requirement. Eric, we'll take the next question, please.
Up next, we have Ella joining us now. Ella, welcome. Please go ahead.
Hello, good evening. Hi, can you hear me?
Yep, you're joining us live on the line. Please go ahead.
Oh, thank you. Thank you so much. I have a question about the wait time for urgent care, because I've known somebody who was there. It was a while ago. There was not enough beds, and the woman had a serious condition, and she had to wait for bed, and she couldn't get one. So she had to somehow move to a different hospital that had bed, and unfortunately she had a critical situation. And that's what happened. So my question is, how is that happening right now? That's my first question. And my second question is there enough doctors to kind of diagnose the person fast if it's an emergency and to do treatment, because she was offered something like that she didn't need. She was really emergency patient. So that's my questions.
Okay, no, thank you for the question. So let me start with your second question first in terms of access to an emergency medical professional. So when you arrive in emergency, there is a triage structure where we triage patients based on the acuity of their presentation. So depending on that triage, which is 1 to 5, 1 being the most serious, you're seen by a clinician based on standardized times. So if you're seriously ill, you're seen within minutes by a clinician to ensure that you receive timely care. As it relates to your second question, which is the wait times in Emerge and access to an inpatient bed, as Mary Agnes pointed out earlier, it is a challenge across this entire province in terms of wait times in emergency, in terms of access to an inpatient bed. So as Mary Agnes said, on certain days there are upwards of 60 patients waiting for a bed between our 2 emergency departments. And that's not unique to Mackenzie Health. That's a challenge across the GTA and across the province at any given time. As well, when one particular hospital is overwhelmed, which has been the case over the last number of years, especially with COVID, there is a structure that is called the Greater Toronto Incident Management Structure that does move patients between hospitals if one hospital is particularly overwhelmed. So that is a structure that's been put in place for a number of years now to do a bit of level loading across the Greater Toronto area and in other jurisdictions, so that hospitals that are struggling in terms of bed capacity can find more timely care for those patients in another hospital. And in many ways, that's how Coeur d'Alene Hospital first opened, where we became a pandemic COVID response hospital. We cared for 600 inpatient COVID patients from surrounding hospitals as they were overwhelmed. So unfortunately, it is the nature of our current situation where there are just not enough beds and not enough staff to deal with the volumes and the pressures that we're facing. And this trifecta of RSV, COVID, and influenza is just making it more challenging. So I do apologize if that was the situation of your friend that had to wait for a bed, but it is our reality, and patients sometimes have to wait 24, 36, 48 hours at times for a bed, depending on the pressures that we're facing. Eric, we'll take the next question, please.
Up next, we have Elaine, who is joining us for a live question now. Elaine, welcome. Please go ahead with your question.
Thank you. Earlier, one of the questions was, is there any numbers we can call for telehealth? What I'd like to know is, if let's say we have a kidney stone or we think we're having a kidney stone attack, and maybe we don't necessarily have to come to the hospital, is there a phone number, a general number that we can call that either doctors or nurses handle the calls? That's one of my questions. Another question is, okay, do you want me to stop at that one?
No, go ahead with your second question as well, please.
I have a few. A few years ago, I was receiving phone calls about a satellite site that was set up that was part of Mackenzie Health. I'm wondering if that is in existence, if it's like a walk-in clinic in this area in Thornhill. Also, a third thing, I've been to the Cordalucci Hospital a couple times. I've had a heart attack. I do drive, and that walk from the parking lots to the hospital itself is quite the walk. Is there any way, there could be a service from the parking lots to take the patients to the hospital? I mean, that's quite a distance and also I have a sore knee. I have a few things wrong with my knee, and I found it really hard to get to, from the parking lot to the hospital itself. So, and the last question is, does Mackenzie Health or Cordalucci provide MRIs?
Okay, I will do my best. I think there are 4 questions, so I'm going to start with the easy ones first. So I think the last question was, are there MRI services at Mackenzie Health? So both Cordalucci Vaughan Hospital and Mackenzie Richmond Hill Hospital have MRI services. In fact, we have 2 MRIs at each of those sites, so those services are available. I think the third question was the accessibility at Cordalucci Vaughan from the main structured parking into the hospital. So there are means and mechanisms by which we can give you assistance if you require it. At the main entrance, we do have volunteers to support you with wheelchairs and other ways to get to your appointment. But there are also accessibility parking spots that are much closer. So if you go on the website of Mackenzie Health and click on the Cordalucci Vaughan site, you'll see a number of parking lots, and you'll see the accessible parking lots that are available to you if you find the distance from the main parking structure to be too far away. And I'm going to try and remember questions number 2 and number 1. Oh, they're reminding me. The second question is around the urgent care center. So we do have a satellite urgent care center. It's on Jane and Rutherford. It provides urgent care services on weekdays from 4 to 10 p.m. and on weekends from 10 to 4 p.m. And it's an alternative service to the emergency department. So that is probably the satellite that you may have received a call about. And I'm going to... Oh, and the first question was around telehealth. Thank you for that. So there are provincially available services. Telehealth Ontario is a service that's available 24/7. It's staffed by nursing staff, so they can triage your condition and then give you the best direction to go in terms of where to receive services, including directing you to the nearest emergency department if that's what you require. So, Eric, I think we'll take our last question, please.
We have John joining us now for our question. John, welcome. Please go ahead.
It says me?
Yep, John, please go ahead with your question.
Oh, thank you. I just have a comment. I was in the Mackenzie Hospital a few months ago regarding shingles. I had shingles. I must admit that the care that I was given was exceptionally very, very good. So I just wanted to comment on that the hospital was accommodating me excellent care. So I just wanted to comment on that. Thank you.
Well, thank you for that feedback. And again, as I said to a previous caller, our staff were listening in will be overjoyed to hear the very, very positive feedback. And I know how painful shingles can be. So again, thank you for that feedback, and I hope you're feeling better. And thank you all for joining us today. It's been a remarkable year for us at Mackenzie Health. We celebrated 1 year as a 2-hospital organization and launched our new strategic plan. But we're still navigating through a very difficult time, and our healthcare workers are truly doing all they can to deliver the best possible care despite these incredible challenges. Thank you to the residents of King, Vaughan, and Richmond Hill for your continued support of your community hospital. Feel free to reach out to us on social media or by email if you have any questions. Have a great evening, and thank you for participating. And it was great to have so many callers and so many insightful questions. Thank you. Have a great evening, and be well.
Thank you again to everyone for joining us this evening. If you still have any questions, concerns, or feedback that you would like to share with Altaf and Mackenzie Health's senior leadership team, you can email them to publicaffairs@mackenziehealth.ca. Just a reminder, you can email questions, concerns, or feedback to publicaffairs@mackenziehealth.ca. Also, for more information and to listen to a recording of this town hall, please visit Mackenzie Health's website, which is www.mackenziehealth.ca. Thank you again to everyone for joining us, and have a good night.